Let's talk posture, shall we? So quite a bit the last week this has come up. I'm Dr. Cindy Hodgson. I'm a physical therapist and exercise physiologist at Essential Therapy. So let's talk about what we mean when we say sit up straight without slouching. Because when we say sit up straight, we don't actually mean sit stick straight, right? We want you to have a curvature in your spine the way that there should be. So in the anatomy books, that's what I always say, we don't want you to sit up straight. We want you to sit like your spine should be, like it shows in the anatomy books. There are curvatures here. So we won't go into them all in detail, but notice that there is not a stick straight spine there. Of course, a lot of sticks aren't straight either, right? So what we're looking at primarily is, what I'm going to talk to you about right now, is the pelvis and the position of the pelvis to create what I call neutral spine, okay? So there's lots of information out there. You hear people say all the time, I gotta work on my core strength, work on your core. There's a lot of sit-ups and crunches and all kinds of things that you can do for your core. But do you really know where your core is and what position your pelvis should be in, or your vertebrae, your whole entire spine, and your head and neck for that matter, when you're doing core work? So let's just take a couple minutes and talk about that. So I like to use this little cheat sheet and point out to you what I refer to as the triangle. So these 2 points on the pelvis here and our pubic bone looks here and here, but you're really probably more familiar with just thinking of it in your own body. So if you think of the point here on your pelvis, these 2 bony landmarks, and your pubic bone making a triangle, that's what I'm talking about, is this triangle in front. So if that triangle is in a perpendicular position to the floor, nice and straight, that's close to what we would call neutral spine, okay? The opposite of that, what do we see a lot these days? Right, and let's just kind of add a pretend phone. This is what we see, or maybe we're at a computer desk, or a variety of scenarios, right? So how do we correct that easily? We think about the pelvis and we think about that triangle. So the triangle in this slouched position is tilted back, right? You can also think of this whole area, the pelvis, as a bowl. And I use this analogy a lot, it seems to work well. Think of a bowl filled with water. And if that water was in a pelvis that was like this, it would be pouring out the back. You see how that would be? But if we tilt that triangle where it's perpendicular to the floor, now that water is balanced within the rim of that bowl. And that's really what we want. If we take that also to standing, because in sitting, most of the time when we slouch, the water would be pouring out the back. In standing, in a lot of cases, not all, but that tilt is too far forward. See that extra sway in the back there? So that's a sway back. Where would that water be pouring? Out the front. Now let's think of our triangle. Let's tilt that triangle back so it's perpendicular to the floor. And now we have a better position. This is neutral spine, okay? So we have lots of different things that we can do to practice neutral spine, to find neutral spine. A lot of times it's hard to even know where that is initially. So we start there with awareness of neutral spine to begin with, practicing how to get there, and then finding it throughout your day. And remember, when you're doing your phone work, you don't just have to have it down here with your head bent forward. You can just simply bend your elbows and have your phone up here, and that makes it much easier to have a better posture, okay? So when we bring our head forward, think of a slouched spine, our head is forward, this 16, 18 pound head can weigh up to about 60 pounds, even more, because of the forces when we bring the center of gravity more forward. And that's what we're trying to avoid. That's what brings on a lot of headaches, neck pain, back pain, the list goes on. So more to come on this. If you have questions, please reach out and we will address them and give you some more tools to use. Have a great day.